Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets. We're going to have a fun episode today talking about women, pelvic floor, your partner if you have a woman partner, and the benefits of using some lube. So I have Kristin Damery here. She is a pelvic floor physical therapist. And over the course of her career, she realized one thing that women really need is a good quality lube. And she developed Lava Lube. So we're going to talk about all of that today. So welcome, Kristin. I'm so excited to have you here.
Thank you so much. It's still very surreal when I hear those intros because if you would have looked in my yearbook in high school, most likely to create a lube company is not where I would have been found. I was most likely to say hello. And so, we've come a long way since high school, but I'm very happy to be here and I'm excited to talk about both things. There are two things that I'm very passionate about.
Awesome. Well, I'm so excited to have you. And I think exactly what you said. I think it's a great avenue to get into and not one that any of us really expected to get into. I can guarantee I did not think I would be in this world either.
Yes, but you're making a big difference.
Thank you. I appreciate that. Tell me what got you into pelvic floor physical therapy and kind of then, pelvic floor is a specialty within physical therapy. So how did that kind of come about for you?
Well, when I first graduated from PT school, I actually was in pediatrics, and the owner of our clinic at the time was kind of one of the pioneer women. It was quite some time ago in the whole pelvic floor world. I did not go to PT school thinking I wanted to go to the nether regions. She asked me all the time, "You want to come observe?" And I was like, "No, I want to have nothing to do with that." I, was thinking what a physical therapist did. Muscles are we do pediatrics, those sorts of things, and so it just wasn't part of my thought process. And then I had a baby. Within a couple weeks after having my first kiddo, I had an incident where I was not able to get to the bathroom in time and I peed my pants. And I was like, what in the world? I was embarrassed. I was young. And it just clicked at that moment, why it's so important to be able to have access to pelvic floor PT. And so at that moment, I was like, you know what? I get it. Let's do this. So I started then, and that's what I've been practicing ever since. I mean, obviously through coursework and that sort of thing. And hopefully I'm growing in my practice, every year. But I love what I do. So I'm clinical some days. And then obviously on the side, we do this lube. And I'll tell you that story whenever you're ready for that one.
Yeah, that's awesome. I mean, it's so important. And it's one of those parts of physical therapy that I feel doesn't get enough attention. When I have ladies come into the urology office and they're telling me about stress incontinence, which is leaking with coughing, laughing, sneezing, jumping, those kinds of things, which a lot of us experience either before or after kids, most of us after kids. And my first thing is, you need to go to pelvic floor physical therapy. And they give me this look like, just give me a pill. Why are you making me go do this? And I'm like, because none of the pills I have help with that particular issue. They help with urgency, they help with frequency, but they don't help with leaking when you laugh. So I need you to go deal with the specialists and work with them to actually fix the problem. And it's amazing to me when they come back and they're like, holy cow, I did not believe you, but I'm a firm believer now because it's made such a difference. So I'm really grateful for it. Talk to me a little bit more about the pelvic floor. What is it, why is it important for us?
Yes. And I'm so grateful to you. I'm like, shout it from the rooftops. Not all of our clinicians are that way where they refer. It's still, like you said, it's kind of new. I think social media has really helped. People are getting on and explaining more. And then podcasts like yours, we're kind of seeing it being more of a buzz I'm not going to say, I guess, buzzword,
Yeah.
pelvic health and all that stuff. But yes, what is the pelvic floor? We hear it all the time, but we don't really know what it is. And the cool thing about it is it's so involved. And I feel like once people start to understand how involved it is, they're like, oh, that's where that's coming from. Oh, that's where that's coming from. Because in that
Mhm.
area, we have the pelvic floor, which we'll get into in a minute. We have all our reproductive organs. That's where we go to the bathroom. That's where we have pleasure. There's so many things happening. And I tell my patients, we have to pull back all these layers of an onion to kind of figure out exactly where our symptoms are coming from. So the
Yeah.
pelvic floor in and of itself is a muscular like basket. Kind of if you imagine your trunk and then you kind of go to the bottom part where your sit bones are, like those bony butt bones, is
Yeah.
surrounded by musculature. And the cool thing about it is it's skeletal muscle. And so skeletal muscles can be strengthened. They can be tight. They don't work automatically like our heart or our bladder. They have you have to strengthen them. And, through time, we don't really think about strengthening that area, for whatever reason, whether we were kind of raised conservatively and you don't really go to that area, you don't really think about that area. It's when people start having problems that they're like, what do we do now? And so I typically
Mm.
see people who have waited a really long time to come in and see me because they're nervous to talk about it or embarrassed to talk about it
Mhm.
until it becomes something that has really impacted their life. And I'm seeing people, like I said, because of social media, they're coming in sooner. But the pelvic floor is the driver of all of our core strength. It's a part of our core. It assists in pleasure. Those rhythmic contractions are what help make us
Mhm.
have an orgasm. A tight pelvic floor can decrease our pleasure. So it's just really important that we focus in on it. And obviously, I'm partial, but
Yes. Yeah. So I love that you brought up the orgasm part of it because it's not just about peeing better or being able to control your bowel movements better, things like that. It really does impact our pleasure. Can you
mhm.
speak a little bit more about that?
Absolutely. I can go on and on. And, as we'll talk later about the lube, it's kind of why I jumped into that side too. I just really I love facilitating intimacy. Like I loved it when my
Mhm.
patients are like, I can have sex for the first time without pain in 6 months. Or they'll come in and go, I know this is too much information. And I'm like, no, this is what I do for a living. I love that part. I love restoring
Yes.
that. So, as far as pleasure is concerned, the pelvic floor, when it is contracting the way it's supposed to, when it's relaxing the way that it's supposed to, whenever we're having blood flow, which blood flow
Mhm.
allows for erection and allows for the clitoris to kind of get engorged for us to have those pleasurable sensations, that rhythmic pumping of the pelvic floor is what allows for that blood flow. Also, there's nerves down there that are very much associated with pleasure. The pudendal nerve that innervates the
Mhm.
clitoris and the penis and the anus and all of that. If we're stuck in a really tight, spasmed pelvic floor, the transmission of those sensory sensations are just going to be diminished. If we have a tight
Mhm.
pelvic floor, orgasm for a female is really difficult because we're not getting, it's just stuck there. We're not getting that rhythmic pleasure that we're supposed to.
Mhm.
Also, a relaxed pelvic floor. And I don't want to confuse relaxed with weak. There's two
Mm.
different things there. But a relaxed pelvic floor reminds our body that we're in a safe space. If we
Mm.
have a really tight pelvic floor, our body is in that fight or flight, like what's happening isn't pleasurable. I'm in danger. I need to leave this situation. And there may be some situations where people do feel that way, and that's a different story for a different day. But if we are in a safe space and we're wanting to
Mhm.
participate in pleasure, if we have a tight pelvic floor, we're working against each other. And so a relaxed pelvic floor is just a reminder to our body that this is supposed to be pleasurable. We're supposed to enjoy it, and what we're doing is safe. And I feel like that's a
Mhm.
huge part of the pelvic floor.
Yeah, I absolutely agree. The other one that I thought was interesting is for my men
Yeah.
who come in with testicular pain.
Hmm.
And we've done the scrotal ultrasound. We know it's not epididymitis. We know, like, I'm feeling there's nothing anatomically wrong with your scrotum, your testicles. Everything is fine. There's no, the ultrasound doesn't show torsion, doesn't show anything. I've started sending my guys to pelvic floor physical therapy, and I've had great success with that.
Hmm.
What is it about the pelvic floor that can cause that testicular pain like that?
Yeah, it's not typically. It's often nerve related. If we have
Okay.
a young, healthy man, let's say he loves cycling, there's been
Mhm.
a fall where they've kind of hit tailbone-ish type even, or split where they fell. When you get shearing of the pelvis and then all the muscles are like on lockdown, we start getting that tightness around the pudendal nerve. That's most common in my opinion, but also, without getting too anatomical, the rectus bellies of the abdomen come all the way down, the six-pack muscles come all the way
Yeah.
down. And I find in men oftentimes that those abdominal muscles where they insert right there underneath the pubic bone are like, whew, they're on lockdown too, which is kind of creating a tight pelvic floor as well. So for men, they have a pelvic floor too. It's very involved in the same. That pain typically is coming from tightness, and I can't say all the time, but a lot of it's that pudendal nerve.
Yeah.
So it's
Interesting.
really just assessing those muscles to make sure, there's other things too, but that would be my first go-to. And if they have any are they having trouble with erection too? Are they, having pain in any other capacity? So.
Yeah. Yeah. And a lot of times I have seen that if they are my chronic testicular pain guys, they generally have pain with an erection or during ejaculation or something else that can correlate, but
Mhm.
it seems to be very sexual related when they're engorged, when they're turned on, maybe
Mhm.
after vigorous sex, then everything tightens up a little bit and hurts a little bit more.
Yeah.
It's very interesting.
Yeah.
I love that I have you guys to send them to because I tap out at that point. I don't know what the heck to do for you. Like, there's nothing medically for me to fix. So I don't know, just breathe through it, man. So
Yeah.
I love
You're doing
having you
you're
guys
doing
to
the
send
right
them to.
medical thing. I mean, you're doing great, and
Yeah.
and like I said, I'm so grateful. It's neat to hear that you're seeing them come back, and kudos to whoever you're sending them to. You're seeing them come back being better and grateful for that
Yeah.
referral. I have had some physicians that I've told, "I promise I will make you look good." And that's not saying I work miracles. It's just saying we have a little bit of a different way at looking at things
Right.
we're
Yeah.
both medical. We just look at things a little bit differently. And as a team, I love my urologists who are willing to be a team. Same with gynecologists, OBs. If we can kind of
hmm
layer on our skills, the patient outcome is just so much better.
Yeah, I absolutely agree. And to that point, I don't have time in my 15-minute appointments to assess every muscle. And I'm not good at that anyway, but to assess every muscle and where you're tense and where you're not tense, and maybe this muscle's too tight and this one's too loose and whatever, that's your specialty. You're good at
Mhm.
it and you have the time for that. So I want them in your hands versus my hands that are not capable of doing those same types of things. It's not my area of
Mhm.
expertise.
Mhm. Yeah. Yep.
Yeah. And I think it's also important, and I want you to speak on this. I will have some people who are just adamant, I don't have time to go to physical therapy. I can't afford the copay, whatever. Can I just Google the exercises and do them? And that's not always the best decision. Can you talk
Mhm.
on that?
Yes, absolutely. I feel like typically when we think about the pelvic floor, we think about it needing to be stronger.
hmm
That's just kind of, we've heard Kegels, Kegels, however you choose to say it. We've heard that over and over. And I have people come in and like, I'm doing the Kegels. I learned them on this. And there's a person on TikTok who has it. And I love that. It's raising awareness. I
hmm
think it's great. But I also want to speak to that we need an assessment to determine if it's actually weak. If you have
hmm
a really tight pelvic floor, you're doing yourself harm because we're trying to strengthen this muscle that's stuck in a tense position and it's creating more pain. And so it just takes a little bit of that professional assessment to make sure you're on the right track. I often, when
Yeah.
people come and they tell me those things, I live in I'm not super rural, but there's a lot of rural outside and they come from like an hour or longer away. That's a
hmm
long drive. It's expensive. It takes a lot of time. And I'm normally willing to say, hey, just come in one time because
hmm
the education about what's actually happening, and then you have this filter to look up online, the things
Right.
that might be helpful, but at least you're not going to be doing things that are harmful.
Yeah.
And so that's kind of
In
how I
that
handle that.
regard, if you have some of these patients who come once or twice here and there to get these exercises because of how rural you are, would you recommend that they come in like once a month so you can kind of change things up and reassess them?
Absolutely. And it depends on their stage in life. I feel like
Mhm.
sometimes we have people who can do a lot. The manual therapy part is the part that's most important, in my opinion. From a skilled standpoint, if I
Mhm.
need to do some muscle work, soft tissue, myofascial release, that sort of thing, on occasion, I can do that one time and people notice a big difference. But typically, I say you didn't get here in a day, you're probably not going to get out of here in a day. And so that's the
Yeah.
part that I normally, if somebody's having a whole lot of pain, I want them to come in because they need that manual therapy part. Now, if they're having
Mhm.
just incontinence, I don't mean just incontinence, but if incontinence is their main struggle, and we can kind of talk through why they're having that and decide on a good plan of care, and they can go home and do that, then I'm totally
Mhm.
okay with following up in a month and following up in a month or even on a phone call because we can talk through that a little bit
Mhm.
easier. It's the patients who come
Yeah.
in who have pain that I really want to be hands on with them for a little bit of time. So it really depends on the diagnosis, on how comfortable I
Mhm.
feel with saying, do these and let me see you in a month.
Yeah, yeah, that makes sense.
Hmm.
It is really interesting, because it's not just incontinence, like you said. Incontinence is really life altering for a
Yes.
lot of us that deal with it. You have to wear pads, you have to know where the bathroom is, you bring extra clothes with you. I
Uh-huh.
grew up with incontinence actually, and
Mhm.
I was from a very small town, so I had both my parents as teachers, and I kept clothes in both of their rooms. And for the longest time it was, well, Stephanie, just go to the bathroom when you have to go to the bathroom. Well, the way my body worked at that time, and I've done a lot of work so that it's not like this anymore, but I didn't know that I had to go until I had to go. And my urgency was so strong, I didn't have time. I was the one that was holding myself and running and maybe squatting till that the urge went past and I was
Mhm.
able to regain control and walk to the bathroom. But I always had extra clothes. It's extremely embarrassing and upsetting for your life. And,
Mhm.
thankfully, I did my pelvic floor PT. I was on an OAB med for a few years, things like that, and I have good control now. But I think that helps me be sympathetic to my patients
Oh,
because
yeah.
it was so embarrassing.
Mhm.
And that was my first experience with a pelvic floor physical therapist. I think I was 18 when I finally went. And it was embarrassing and uncomfortable because nobody told me that there was going to be an internal exam. And the
Yes.
only internal exam I had was like my first pap smear ever, right?
Mhm.
So, like, I always make sure I educate my patients to expect that because that was threw me off. But I'm so grateful for that because it also helps me reiterate to my patients how important it is and how
Mhm.
life-changing pelvic floor PT can be for some of our issues.
Mhm. And it's not even just for the person, it's expensive. I mean, those pads and
Yeah.
stuff get so expensive, and I have women, who won't, and men who can't golf. They can't go out to their
Mhm,
functions because they're afraid that they're gonna have to rush, and it's embarrassing. So, like you said, it's so life altering, and oftentimes we
mhm.
get, I have some older patients that come in, and going out with their friends is the only human contact that they're gonna have for, a good long time, and that starts
Yep,
really becoming depressing. It's depressing for everyone, but if your only time you're going to see your friends and you don't go because you're afraid you're going to have an accident, just
yep.
really is this big, all encompassing, very overwhelming thing.
Yeah, yeah, it really is. And, okay, so let's get into the journey into the lubricant that you
Yeah.
make, the lava. So
Mhm.
tell me kind of that road down there.
Sure. So I was always recommending lubricants, and there's not a one size fits all on lubricants by any
Mhm,
means. There's multiple kinds. They are used for different reasons. And I one day was sitting there and I thought, you know what? I should just formulate my own. Well, there's a whole lot more that goes into that than just formulating your own. I found that out real quick. So it was about a 2-year journey. And I wasn't like in my kitchen formulating, you know what I mean? we have
yeah,
you have people who do that for you. But I was thinking to myself, like I said, I grew up very conservative. In my mind, I'm like, what is my reasoning for wanting to do this? Do I think it would just be cool to say that I'm a lube slinger? Or like, what's my why on doing this? I have a family and kids. I'm like, do I want my kids to be like, my mom makes lube, And what I kept coming back to is why do I like it so much when I treat patients with pelvic pain? And
mhm,
the reason is because when we do well, their relationships are restored. And that
mhm.
is life changing. I loved
Yes,
that part. And I was like, how can I, not that my patients aren't important, they are, and I'm still clinical, I still see them and I love that, but how can I do this on a grander scale? And that's
mhm,
kind of where the lube came in. Now, lube does not take away all of the problems. There's just a
sure.
select group of people who need lubricant or want lubricant, but it gives me a different platform to be able to have conversations like this, to be in a
Mhm.
different a different environment, talking to different people. And then also, we're continuing to create. We just launched in July. We have our personal lubricant, but right now we've got other products in research and development. And it's a really cool way to try to think of what problems are that I know and be a part of creating a solution. And so
Yeah.
our lubricant is a silicone-based lubricant. A lot of people freak out about silicone. I did that on purpose. It's hyperallergenic, dye-free, fragrance-free, preservative-free, and the molecules are too large to be absorbed by our body. So if we're talking about a lubricant that, I'm not going to say clean, it's synthetic, but a lubricant that is not impacting us internally, silicone's where it's at. And so that's why I started with that one. It lasts a long time. It really is luxurious and a great option for some
Yeah.
people. There's other reasons why a person wouldn't use a silicone based one, but that's kind of why we started that.
Yeah, absolutely. No, and
Mhm.
I have to tell you, Kristen had sent me some samples, and my partner and I did use them, and they are fabulous.
Thank you.
And so comfortable, easy to wash off afterwards.
Mhm.
I know some people worry about that with silicone as well. And, one of the other biggest things with the silicone is we don't want to use them with silicone toys because
Right.
that disrupts the silicone. But it is a really great thing. And I love that when I looked it up, there are 3 ingredients
Mhm.
in your lube. And I have told my patients for a while now, if your lube has more than 3 to 5 ingredients, pitch it and go get a different one because
Mhm.
we do not want all this extra crap
Mhm.
going in our bodies, especially in such an absorbent area that
Yes.
is thrown off by the littlest things in our pH.
Yes, that pH is the kicker. And the toys, I love a good toy. So, I'm not
Yeah.
against that at all. So, you do need to have a hybrid or a water base with that, but you do want to be careful because it has water. And water
Yep.
is what changes the pH in those and sugars and that sort of thing. And I made a post on Instagram the other day that talked about how natural is kind of a buzzword. Natural
Mhm.
still includes sugars and,
Yep.
different types of things. And so we have to be really careful and kind of educate ourselves as a consumer on what that natural actually means because it may not
Same with
actually be
organic.
healthy. Yeah, organic and natural may not be healthy. It may be sugar and,
Yeah.
water and those sorts of things, which are not always bad. Water-based lubricants have their place.
Yeah.
For sure, but you just want to be careful. And if it's somebody who struggles with something like that, obviously you want to pay more attention. Or if somebody struggles with BV, you want to be careful about
Mhm.
oil-based just because
Yep.
that traps down that bacteria. So it's good to be
Mhm.
educated and maybe have a plethora to choose from depending on the
That's right.
day. Yeah, why
Yeah.
not?
It's interesting because I used to only ever recommend water-based because
Mhm,
you think of it as being more pure.
mhm,
And I was talking to a different consultant with a different, I mean, she sells a variety of things. She doesn't have her own products. And we were talking through it, and she's like, you know what? Some of the worst lubricants out there are water based because they
mhm,
throw all this other crap in there because water reabsorbs so quickly down there that they'll put other stuff in it to make it last longer. Whereas if you get a good quality silicone one, it's going to last because it doesn't get absorbed as easily and you don't get all the extra crap with it. And that really
mhm,
opened my eyes to like the differences and like to actually do some more research myself and kind of figure out those ins and outs of lube because I really thought I was doing my patients a good service, especially the ones with recurrent UTIs and BV and
mhm,
things like that by saying, yeah, use water based. That's going to wash right off. It's going to be good for you. But I didn't put those extra caveats on. Make sure that it only has 3 or 4 ingredients. Make sure that, and I started going to the store and reading the back of them, and I was so surprised by
mhm.
the obnoxious words that I couldn't even pronounce,
Yeah.
the plethora of ingredients. So I love that yours is very simple, straightforward, and clean, like you
Thank
said.
you. I had someone post, I feel like we all become keyboard heroes whenever our faces aren't showing. And I had somebody make a comment the other day on one of our ads, and they were like, "Oh, so it's silicone, gross." And I am not a sharp-tongued individual, but whenever I hear that, I'm like, let's respond in a way that helps educate them. So
Mhm.
we just said, we would recommend you taking a look at your current lubricant and comparing the ingredients. And obviously, I
Yep.
have no idea how that turned out. I never will, but I would love to educate people on that And there's different reasons for different ones, like I said, but I hope that part of what we're doing here and, what our posts and stuff are doing are educating people to just at least look, not just trust it
Yeah.
because it's a household name or not just trust it because it says natural, but to actually take a minute to kind of check it out themselves.
Yeah, absolutely. So when you started using this for some of your patients with vaginal dryness, like
Mhm.
what were the women that you kind of were like, "Hey, you have this symptom, I think you should try this lube."
Yeah.
How did that kind of play out? What are those symptoms?
Menopause. Ooh, we,
Yeah.
we have to get, we start having that estrogen depletion. And as you probably know, there's been huge gains in the whole estrogen world in the past
Yes.
couple months, and we're excited about that. And so hopefully we start seeing that come into play with our gals who are a little bit afraid to use those estrogen creams or
Mhm.
however their clinician prescribed it. So I think that's going to help a ton. But we still will have some women who are nervous about estrogen, or maybe it's not the right fit for them. And so silicone based lubricant definitely will stick around. Those water based ones are not going to do a darn thing. They're going to
Yeah.
evaporate just like water would on your hand. So menopause is a really great time to use it. Women who are postpartum, that's a
Mhm.
great time because their hormones are in flux as well. And then oftentimes maybe they've had a tear, maybe they had an episiotomy.
Yeah.
There's things that make that tissue around the introitus, around the vaginal opening, a little bit more tender. And so, kind of those first couple times after having a baby are nerve wracking. It just
Mhm.
increases pleasure overall. And it
Mhm.
can be used for other things as well. I feel like whenever we have been, we're we're kind of craving something new. Novelty is
Mhm.
something our bodies crave. We like to try new restaurants. We like to go to new cities. And a lubricant is just a really safe and fun way to
Yeah.
start introducing something a little bit different. It can be drizzled and skin to skin contact with a lubricant. It can be used for back
Yes.
rubs. It can be used for, it's just a cool way to introduce something new and novel to the bedroom to increase pleasure. And maybe a person doesn't need it all the time, but
Mhm.
they want to use it all the time because it
Yeah.
feels good. But the diagnoses that I would say for sure would be menopause, postpartum. Those are good indicators.
Yeah, definitely. I see a lot of vaginal dryness. I treat a lot of perimenopause and postmenopausal women,
Mhm.
and I love throwing them on estrogen. But there are a few women who are either still too afraid, but generally I can talk them out of that by
Yeah.
showing them the actual research. But there are some women who have endometrial cancer, uterine
Mhm.
cancer, things like that, or active breast cancer treatment where their oncologist is like, yeah, the research shows okay, but like, let's just not take that chance right now.
Yeah.
Let's get you through treatment and then try. So there are a few people who, like you said, just aren't good candidates for estrogen.
Mhm.
I also have some of my ladies who can't tolerate the estrogen cream and have
Mhm.
to use some of the tablets,
Mhm.
which I don't know what you've seen with some of your patients, but I find that the ladies who use the tablets, they kind of feel better. They get some better urinary, less frequency and urgency, things like that. But I haven't noticed it help as much with the lubricant
Mhm.
of that vaginal area as much as I see the creams help with.
Yeah. And maybe that's just because we're, actually applying to the tissue
Yeah.
that needs it. I don't really know what the backing would be on that, but that kind of seems to make sense in there too.
Yeah, absolutely. But yeah, I think it's great. And one of the other things I like about it is, sometimes when you're having sessions, you maybe take a break and do oral sex or play with each other with your hands or something like that.
Mhm.
It's
Mhm.
very smooth to use for those things as
Mhm.
well. And it's not really sloppy or messy or anything where I'm worried about my sheets getting ruined. I liked the feel of it with that part of the experience in the session as well.
Mhm. Good. I'm so glad. It's like you're talking about my kiddo, you know what I mean? It's like, that just puts a pep in my step. Thank you so thank you so much. I do have a shameless
Yes.
plug. We're actually almost done with formulation for a clitoral stimulant, and I call it a
Ooh,
clitoral stimulant. It can be used to stimulate all kinds of things.
yeah.
But some funny stories is the chemist creates it and then they send it to me to try. And obviously I send it out to some other people to try too because we just want to make the best formulation possible. But when I know it gets in the mail, I'm like, "Hey babe, look what day it is."
Yes.
Now he's like, "Oh, the samples are here," because it's really fun to try out, but it's a
Yeah.
stick, like a chapstick. And that's
Okay.
another thing, clitoral stimulation
Mhm.
is what creates lubricant, or arousal
Yeah.
is what creates lubricant. And so that's one of those things that I said I like to try to target a problem. And I feel like oftentimes women they require a lot of clitoral stimulation. I mean, that clitoris has so many nerve endings. We're talking like 8,000
Mhm.
nerve endings, more than the penis, more than any other organ in our body.
Yep.
And so the ability to have some assistance with clitoral stimulation will also increase a person's regular lubrication, which
Yeah.
is beneficial too. That was a shameless plug. Look for it in the
I love it.
spring. It's going to be so great.
Yes.
I'm really
I
excited
mean, if
about
you
that one.
need somebody else to try it out, like, I'm happy
Girl,
to help,
yes, I will
for
send it.
science.
I will send it to you. I have not had any negative feedback. It's all been great. I'm very, very excited about it. It's just one of those hurry up and wait things, you know. The good
Yeah.
thing is that we want to make an excellent product. We want to make sure it's super safe.
Right.
And so it does take a minute to do things the right way. And we are doing it in the right way, but it's
Absolutely,
going to
and I
be,
appreciate that about you and your
yeah.
company. That's
Thank you.
wonderful.
Thank you.
Okay, so with the lubricant,
Mhm.
how about using it with condoms? Is it safe to use with
It
condoms?
is, yes, yes, it is safe to use with condoms, which is also a beautiful thing. Yes, oil-based is not. So you wanna be
Right.
careful with those oil-based lubricants, but silicone-based is. I don't even know if there's a silicone condom out there. I should probably look that up. If it was a silicone condom, you wouldn't wanna use it with that, but all the other types
Right.
are just fine.
Yeah.
Yeah, it actually helps with condoms too because any lubricant because you are decreasing micro tearing, you're decreasing the likelihood of the condom tearing because you're
Mhm.
allowing that nice glide. So I feel like it increases the safety. If you're using a condom for what they're intended for, we're
Yeah.
trying to prevent something. And so, we
Yes,
want it to stay intact.
that's
And
right.
lubricant really helps with that as well.
Yeah. Yeah, one of the things that I like it for is I'm, like, in my perimenopause phase. I like, with penetration, sometimes my external area will start to dry, and that friction is uncomfortable.
Yep.
It's not a good feeling. But when I use the silicone lube, it's on all of those areas, and the sliding is much more comfortable, much less, like, pulling sensation.
Mhm.
It's just more of a smooth sensation. So, I really like that. I think that's been really nice for me personally. I think it just changes the friction to more of a smooth gliding
Mhm.
versus, like, kinda thing.
That's kind of what I feel like, when you're thinking about the way you market things, like it's very slippery. And I think a lot of times people think like, I don't want it to be too slippery down there, but it is still friction. It still feels
Yeah,
good, but it's not like a painful friction. And so the
right.
sliding is not in a negative way. It's just a very smooth, like luxurious way. So I appreciate
Yeah.
that feedback. Thank you. I need to just hire
Yeah, and I
you,
don't
just hire you full time.
be a brand
My
ambassador.
brand ambassador. Yes.
I'll just be handing out things of lube in the
Please
bathroom, like, "Here
do.
you go."
Yes, yes, I'll send you some.
I travel a lot. I'll just leave them in the bathrooms at different airports for you.
How funny would that be if you walked out, somebody would be like, "Look what I found in the bathroom."
That'd be great. I
That'd be
love it.
awesome. Yes.
Yeah. No, I mean, it's just such an important thing. And, I think for a lot of ladies too, especially ones who have always had plenty of personal lubricant. And then
Mhm.
all of a sudden they're postpartum, they're going through hormonal changes. Maybe they've never been on birth control and now they're on birth control. Something has changed and they're not quote unquote wet enough anymore. And some women will really take offense to that. And some of their
Yes.
partners will take offense like, oh, I'm not turning you on enough anymore. And that's a really negative thing and very sad
Mhm.
because we don't have any more control over that than men have to get an erection.
Right.
And so if your erection changes with drinking alcohol or with age or with your blood pressure medicine, our bodies change with our lubricant as well. And so
Mhm.
I think this kind of just like takes that out of the factor. Like, look, I just like the feel of this lube. It feels great. It makes sex better. I like the friction that it gives us without being too slippery and sloppy. It doesn't stain my sheets, all these things. So we just use it because it enhances things. And then there's none of that. Well, you didn't get very wet today. Were you not into it?
Yes.
Well, no, that's just the way my body was today. Maybe I was
Mhm.
dehydrated. Maybe I don't know, whatever.
Mhm.
I'm a human.
And there's those things, I think what we don't know is just like the general population is it's so impacted by medicines, it's so impacted by dehydration. It's
Mhm.
obviously we start thinking about the hormones just because menopause is kind of another
Yes.
buzzword right now. But there are a lot of things that impact that other than just I'm not aroused or I don't, I'm not
Right.
feeling it. And so we have that correlation in our minds just from not being educated about the fact that other things can lead a woman to not be wet or aroused. And the pellet
Yep.
floor plays a part in that too. All of that's so involved. And I I want to, and we had visited about this, talk a little bit more about the pelvic floor in ways to be able to kind of do a self-assessment of the pelvic floor too. And I hate to jump to that, but I wanted to make
Yeah,
sure that
no, let's do it.
we hit that. Back to the pelvic floor being tight, I feel like if somebody has pain, we start thinking, if you're having
Mhm.
pain with penetration, if you're just having pain in general, that's one of those tightness things. If you're having leakage, if you're having difficulty having a orgasm, those are kind of with that lengthened or not relaxed, but loose pelvic
Mhm.
floors. And
Mhm.
another thing that we really need to focus on is breathing. And when we start to
Mhm.
take those big, deep breaths and start being more aware of the status of our pelvic floor, that also can play into pleasure because during intercourse, there can be those deep breathing moments. That's a connection
Mhm.
moment too, to allow your pelvic floor to remind itself that you're in a safe place. So, for lengthening, things that you want to do are down training exercises like the butterfly stretch, a
Mm.
deep diaphragmatic breath where you allow your pelvic floor to drop. The way that works is when your diaphragm, which is right up underneath your ribs, when it opens up like this, the pelvic floor drops. So if you imagine it like this big ball here, when you take a deep breath in, your pelvic floor should drop. When you take your breath out, it should come back together. It kind of works like a piston like that. So when you lay on your back and put one hand on your abdomen, one hand on your ribs, maybe take a deep breath in and see if you can kind of feel that area open. For a female, that would
Mhm.
obviously be, you can kind of feel the labia of the vagina open. And if you're able to do a really nice breath where it opens and then a breath out where you kind of close in, where you do the Kegels, that's pretty indicative of having a nice range of motion of your pelvic floor health.
Okay.
But the thing that I want people to hear
I'm doing
from
it while you're talking, by the way.
Good, I'm so glad. The thing I want people to hear from our conversation today is that if there's any indicator from what we've said that your pelvic floor is doing something it shouldn't be doing, don't be afraid to talk to your providers,
Mhm.
Go say, "Hey, I'm having a little something." And even if you don't feel super comfortable saying the whole thing, just give them a little bit so they're able to make that referral a little bit quicker. Because the faster we can see you, the better. Us pelvic floor PTs, we're
Yeah.
kind of a different breed. I'm sure that you guys are too in urology. It is like an all out counseling session in there.
Yep.
There's just a trust and people are improving. It's a really
Mhm.
safe environment, I hope, for most. And so once
Yeah.
you get to us, we've heard it all. Our walls, have heard it all. I mean, that's a good time to let everything out, but at least get to us. At least
Yeah.
so try that. Try that deep breath and see if you can feel it open and see if you can feel it close. If it's stuck in some situation and you're also having pain with intercourse, that's a time to say, this isn't normal. I don't need to
Yeah.
cover up my face or drink a glass of wine. I need to go find a pelvic floor PT.
Yes.
Hmm.
Yes, absolutely. And I think that's so important. I actually, the way that you're talking about the breath work, I had a patient come back to me and say, I had no idea I was breathing wrong.
Yeah.
My whole life, she's like 50 something. My whole life I've been breathing wrong because I didn't know that they were supposed to open away from each other while you're breathing in and close when you're breathing out. She's like, I thought we hold our bellies in. We don't want to be fat. We don't want to look,
Yeah,
we're holding in a fart, whatever.
absolutely.
And
That's funny.
yeah. So it's like, we're always holding, and we need to breathe
Hmm.
and open up. So I love that you brought attention to that.
Hmm.
One thing that I found interesting that I learned from one of my PTs was how much the jaw and tension in your face is connected to the pelvic floor.
Hmm.
I was blown away by that. And I've been able to kind of feel it sometimes when I'm gritting and I'm like, oh, yep, my pelvic floor is gritting too. Or when I relax myself and I'm like, oh, yeah, look at that. I'm relaxed there too. It's fascinating to me.
Isn't that funny how your face can be an indicator of down in there? But really, and I'm going to target this at females just because I am a female. I know the weight of the world that we carry oftentimes. And I also know the weight of the world we carry as far as, like your patient said, wanting to hold our abdomen, wanting to stand up
Yep.
tall, wanting to be skinny, wanting to be fit, all of those things.
Mm-hmm.
And that is, we hold everything real tight. We hold everything here and we have stressed.
Yeah.
It's just kind of the way we live. So, if you're having TMJ, if you're having pain, grinding, there probably you do have a tight pelvic floor as well.
Yeah. It's such an interesting connection for me. And I really tried it one time. I tried it one time during sex
Mm.
where I was really like I feel like I'm a little tense today. Like it's not feeling as good as normal. And I realized that I was clenching. And so I was like, ooh, maybe this is a good time to try it. And so I like relaxed my jaw and I took some deep breaths. And all of a sudden I was like, oh, I'm enjoying this way more now.
Yes.
Mind blowing to me.
And
Yeah.
we have to be in a mental. Our mind just is everything.
Yeah.
When we are entering into any time of pleasure, it is stimulated from our mind. We've got to allow it
Mm.
to kind of. I find myself sometimes being like, forget everything. You don't need to be thinking about what's going on. And once I can get
Yep.
in that headspace of not thinking about all the things that go, or if I'm having a difficult time achieving an orgasm, I'm like, what?
Mm-hmm.
Why? And it's normally
Yeah.
because I'm like, oh no, la, 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 I have to go do this after this, I have to go do this after this. And if I can shut that off, which easier
Yep.
for some than others. So that's not a
Right.
criticism in any way, shape, or form. Sometimes it's easier
Right.
for me than it is other times too. But you can see
Yeah.
that connection big time with pleasure.
Yeah. Yeah,
Hmm.
definitely.
Hmm.
This episode has like flown by. I feel like we
I
just
know.
started talking.
Yes.
But I want to give you some time. How can
Sure.
people find you, work with you, plug your lube and your clitoral thing
Absolutely.
again? Go for it.
Yes, I'd be happy to. Okay, so it's called lava, and I have so many people say, "Why lava? Does it heat up?" It doesn't heat up, but let's think about volcanoes, okay? That kinda gives you
Ooh.
why lava. We're erupting in pleasure. That's where it came from,
Yes.
and the funny thing is my husband, behind the walls, we don't market this way. We're very marketed, very elevated and luxurious, but he's like, "We could come up with so many jokes about volcanoes." Like, I know. I know. So here on this podcast, we're erupting in pleasure.
That's right.
Take that for what you will. But my website is mylavalube.com. And that's the same for TikTok at mylavalube, Instagram at mylavalube. I would love for people to follow. I am definitely not a social media star. So, I'm clinical through and through. And so all these
Yes.
things have been really new and I have great team members that help with all of that. But it's a lot of learning and I'm so grateful to be able to have learned it. I knew what I wanted to have for the consumer from a clinical standpoint, and then I've had a great team who's helped me get there. But the clitoral stimulant will be available in the spring. It's going through
Okay.
testing right now, like I said. We do have, it's called Hanky by Lava. We created a bedroom towel, an intimacy towel, which I love. I don't know about you guys, but I have like old dish rags on the side table. There's nothing wrong with that.
Yes.
But
Yeah.
this is just a very nice, it's made with microfiber. We wanted it to be water
Okay.
resistant, but also able to clean. So it's the right size to lay down during intimacy. And then for the intimate aftercare, you
Yep.
know exactly where it belongs. It's beautiful. It's elevated. So we created that for that reason and have replaced our old dirty dish towels that are in the side table with a very nice elevated towels. But we have that on the website too. We also have samples. So we just decided to launch a lava to go for travel, or if you just want to have an easy access, like they're little sample foils here.
Hmm.
So you don't have to have the whole bottle. Obviously, they travel, and it's a good way to
Yeah.
try it. I had quite a few people email me when we first launched and say, "Hey, can I try it? Is there a way for me to try it?"
Hmm.
And so we wanted to make it to where you weren't committing to that whole bottle. Now, let me tell you, if you commit to a whole bottle and for some reason you don't like it, you slather your back up with it. Do massages, make something good out of it. It's good for a lot of different things. Beard oil, use it in your beard. I don't
Ooh.
I don't know. I've never
I
had
like it.
anybody tell me they did that. But there's lots of reasons for it, but I have a feeling you like it. But there
Yeah.
is an option to try it, in a smaller package before you order it. But I would love people to buy it and give me feedback. We're always trying to be better. And then if you just have any questions, there's a contact us right there on our website. I would be happy to answer any questions regarding this episode too. Obviously can't get in too much detail as far as pelvic floor is concerned because I can't do an assessment.
Yeah.
But if there's just a generic question, my team will get that to me and I'd be happy to answer it when I can.
Awesome. Kristin, thank you so much. This was
You're
such a great
welcome.
lube.
Yes. It is a
Great
great
lube.
lube.
Great. I was just thinking, I need to plug this one more time because I really
Yes.
liked it. And
She's got
that just
lube
came
on
out.
her mind. Absolutely. That's a great slide into saying goodbye.
There we go.
No, I'm
There we
kidding.
go. Yes. Yes. Oh my goodness. This is a great episode. I love it. Thank you,
Thank
Kristin,
you.
for being here.
You're
Everybody look for episodes
welcome.
every week on Wednesday. Like, follow, share the podcast so we can grow more. And look for the upcoming clinic that is starting in March called Revive Institute of Sexual Health. You'll find us online at reviveish.com. Have a great week and go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening, and go have some fun between the sheets.